Welcome to the Community Assessment Group Project. I am Professor Rosen, and this PowerPoint is an overview that will provide you with the understanding about what the community assessment is and how you will complete the project. There are 3 public health core functions: assessment, policy development, and assurance. Within these 3 functions are the 10 public health essential services. The community assessment is a core public health function because the public health nurse is assessing a community. The public health nurse is also providing 2 out of the 10 public health essential functions. The first one is assessing and monitoring the health needs of a population. The second one, the PHN investigates, diagnoses, and addresses the health hazards or environmental influences and the root causes of health issues in that community. These are the objectives for the community assessment. Conduct a nursing assessment by using the nursing process, and you will use community as your client. You will create an eco-map that identifies institutions and organizations that are barriers or facilitators for the identified group. You will identify 1 community nursing diagnosis. You will explore a health policy issue affecting the targeted group. You will plan an intervention in the form of 1 group project activity lesson for a targeted group. You will implement the activity lesson, and you will evaluate the effectiveness of the activity or lesson. For additional clarity, your first group project, the community assessment, will include assessment, diagnosis, and planning. Your second group project, the health activity lesson, will include implementation of the health activity lesson and evaluation. To begin, let's look at the first slide again. What is a community assessment? Well, first of all, the community assessment is a process for determining and addressing needs in a community. It is used to clearly see a problem and to identify appropriate solutions. In this slide, we see the perfect little community. There's a central park for families to gather and get to know each other. It's a safe area for kids to play. We see 2 police officers keeping the peace. There's a fireman testing the fire hydrant. There's a woman reading to young children. There are vendors selling food and other items. There are trash and recycle bins. Surrounding the park, we see clinic, restaurants, grocery stores, the library, public transportation, banks, a school, a community newsroom. Way in the back, there's a hospital, and there are other various places. All of these places make up the resources and public services needed to contribute to a healthy community with persons reaching optimal healthy outcomes. So in this photo, let's also consider that this community is regulated by certain policies. Policies are important in a community because they protect and enforce health codes or provide much needed services such as safety, services to the disabled, and so on. Can you guess what kinds of policies are in place just by looking at this community? Some might say yes, some might say no. I'm gonna guess. I'm gonna guess there's a no smoking allowed policy at this public park. I'm gonna guess that all the vendors are licensed. I might even guess that there could be a fine for littering because the place looks so clean. There might be police patrol dedicated to park safety. I don't see any homeless people, so maybe there's a homeless shelter in the community. I don't see any fast food places, so it's not my community. So maybe this is a community that doesn't allow fast food chains. Or I don't see liquor stores, or my eyes are just not working right now. But I really don't. I don't see any liquor stores. I see the grocery store. Let's see. Okay, so now let's try to identify what's wrong with this community. Can you see any issues about this community? Maybe I see a little boy on a skateboard on the sidewalk. What are the potential dangers of that? Yes, I think skateboards can injure people sharing the sidewalk. I see some children who are alone. What are the dangers of children going to the park or being at the park alone, unsupervised? I don't see crosswalks or streetlights surrounding that vicinity. And there's a bus coming. There's a bus coming down where kids are playing at the park. One kick of that soccer ball and someone's going to go chasing it right in front of the bus. In front of the grocery store, there is a blind man walking. You see the man with the cane? You might have to make your picture a little bit bigger. He could get hit by the bus or if this community doesn't put one of those audible streetlight indicators for the blind, then he won't be able to cross the street without help. Do you see any resources for the blind community? I don't see any resources at, say, Braille Institute or a blind school or something like that. So this community has a lot of social resources, or it serves a lot of social determinants that contribute to a good quality of life and good health outcomes for many members of this community. However, some community members will not be able to obtain the same quality of life and optimal health outcomes. Some members will have poor health outcomes. And it is those members or vulnerable groups of people who are going to be impacted by what's going on in the community or what's not going on in the community. And that is what we as nurses must identify and change. Well, how do we do that? We conduct a community assessment. A community assessment is the process of identifying, analyzing, and prioritizing the needs of a target population like the disabled, the elderly, persons with chronic disease, persons living in poverty, the homeless, immigrants, persons who do not speak English, infants, children, teens, pregnant women, single parents, victims of violence or abuse, and those are just to name a few vulnerable groups. A community assessment will help you understand the health issues caused by the social barriers people face in a community. A community assessment will help you identify the good and the bad health behaviors practiced by individuals who live in the community. A community assessment involves collaborating with community partners, such as the partners you work with in our clinical rotations, or partners that care about the target group you have chosen. The community assessment requires nurses to document their observations, collect statistical data, and collect data or interview community members, persons who live, work, and age in the community. The result of a community assessment will guide future nursing actions. Many organizations perform and publish a community assessment every 3 years. This slide shows the front page of UCI's community assessment. It's titled Community Health Needs Assessment, and it's abbreviated CHNA. The Orange County Health Department calls theirs Community Health Assessment, abbreviated CHA. In each publication are data from various data sources. The Orange County assessment provides data at the county and state levels. It compares Orange County to the state of California in many areas, such as the number of persons with health insurance, the number of persons who visited the dentist in the last 6 months, the number of ER visits caused by asthma or COPD, and much more. The UCI publication provides data and statistical information about its surrounding cities. So you should find the nearest hospital closest to your assigned city and review their community health needs assessment. It may contain data about your assigned city, and you can use that data if you wish. Social determinants of health and health inequities. Barriers to social determinants of health lead to health inequities. Health inequities are differences in health status or in the distribution of health resources between different population groups, arising from social conditions in which people are born, grow, live, work, and age. People's living conditions are often made worse by discrimination, stereotyping, and prejudice based on sex, gender, age, race, ethnicity, or disability, among other factors. Health inequities are unfair and could be reduced by the right mix of government policies. According to the Centers for Medicaid and Medicare, health inequities means the attainment of the highest level of health for all people, where everyone has a fair and just opportunity to attain their optimal health regardless of race, ethnicity, disability, etc. According to Healthy People 2030, there are 5 main social factors called the social determinants of health. They include income level or economic stability, neighborhood and built environment, access to healthcare and quality healthcare, access to education and quality education, social and community context. If you need a little refresher about the 5 social determinants, go to Healthy People 2030 website. You will find the section where each social determinant is clearly explained and given examples. Assignments. Each group is assigned or will be assigned a city. So write down the zip code of the city. The zip code will be the boundaries you will stay within. You can use Google Maps to identify those boundaries also. Use Google Maps also to find a starting point for your community assessment. This could be a senior center, a park, a community center, an apartment building, or a family resource center. From there, you will start your windshield survey. What is a windshield survey? Well, you will assess the physical environment of the community by driving around and looking out your windshield. You will walk around also. You will assess the people and look for people to interview. I've provided you with some resources. One of them is a research article about the windshield survey. One of them is a windshield survey template and instructions. And one of them is a scavenger hunt. You can use all 3. You can use whatever you want, okay? This is just going to provide you with guidance on what to do when you go out and begin your windshield survey. Finding subjective data. So as you are driving or walking around, you will use your senses to gather information. You will use your sight, smell, hearing, taste, and how you feel. Do you feel safe? If you don't feel safe, you can ask your instructor to accompany you. Take lots of pictures of people, places, things, resources. You will look for evidence of behaviors. You will look at people, what they're doing or what they're not doing. Do people look healthy? As a community health nurse, I would frequently see children walking around with holding baby bottles, and these kids looked like they were 4 and 5 years old. I would see children with black teeth. I would see children walking across busy intersections without holding an adult person's hand. So those were some of the safety and health issues that I would see right away. You might see graffiti, trash, unsafe areas. You might see people using drugs. You might feel that the air is not clean, so you might want to do an air test. Go to air.gov to do some clean air test. You might see apartment buildings without screens. While you are out in the community, start talking to people. Find out what's right and what's wrong where they live, in their area, with their community. Find out what's impacting their quality of life. What are the resources people are using for healthcare? Can they access healthcare? Do they have educational resources? Financial stability? Do they feel safe and flourish in their own homes? Do they feel like they're participating as a community member? Finding objective data. There are many resources that provide data. As I said previously, hospitals provide a community needs assessment about their surrounding cities. The Orange County Healthcare Agency's publication provides county and state data. There is one publication dedicated to children, and that's called Conditions of Children in Orange County. There are various websites. cityhealthdashboard.com. This is a website where you can insert the name of the city in their search bar, and they have some health data and behavior data that come up. There's a lot of information in these resources, so don't get lost. There are many different groups that you could choose to be your target group. Choose your target group as soon as possible. You need to have a focus. Community resources. When you are out in the community, you will be looking for resources. What do I mean by resources? Resources are places, businesses, or agencies where people get their needs met. Resources could be family resource centers, WIC, women, infants, children, community centers, parks, gyms, social services, health clinics, schools, colleges, fast food, food banks, convenience stores, grocery stores, public transportation, clinics. Did I already say that? Resources can be healthy or unhealthy. For example, 7-Eleven is a convenience store that accepts EBT cards, but they also sell mostly unhealthy foods. Bars can be a place to socialize, but over drinking alcohol can be an issue. The EcoMap is a visual representation of resources that you see on this slide. It has your target group in the middle. The surrounding resources pertain to your target group. Those are the resources that your target group uses primarily. You may need to ask people in the community what resources they use to meet their health, food, educational, financial, transportation, social, and familial needs. This is why it's important to know your target group, to select your target group as soon as possible. The clinic site, a community partner, can be a resource also. To learn how to properly create an EcoMap, use your article, EcoMapping, an innovative research tool for nurses. It will explain the lines, arrows, and the key that are needed for your EcoMap. Identify a policy issue. After you complete your interviews, your observations, your subjective data, you will find that there are many policies that affect the community. In this slide, there are 5 ways public policy, impacts health. Creation and regulation of public goods. That's the first one with the little road. An example would be licenses for vendors. Restaurant employees need to wash their hands after using the bathroom. Fast food restaurants have to keep the food at a certain temperature to prevent bacterial growth. How about requirements and mandates to protect citizens? Here we have seatbelt laws, helmet laws, no texting while driving. Creation of opportunities, that's the last one. An example would be financial aid to fund college or tech schools. So as part of your community assessment, you will need to identify a policy issue that is impacting your target group. Describe the environment. This is a reminder slide to describe the city with history, green space, describe the housing, maybe the cost of the housing. Are there overcrowded situations? The social structure, like do poor people live in one area on the east side and the rich people live in a nicer area on the west side? Is there a large homeless population in the city? Is there healthy foods, grocery stores, or just convenience stores and liquor stores within a couple mile radius. How's the air, water, and soil quality? Is the green space safe and accessible? Does it have exercise equipment? You will describe the environment of the community using some or all of these aspects. Religion. Does religion impact the health of a community? Many poor communities rely on religious beliefs to cure what ails them. What is the religious institution in your zip code? Or are there quite a few of them? Are religious beliefs impacting the health behaviors of individuals? How? And is it impacting civic engagement? What is civic engagement? Civic engagement includes people in a community working together to actively address public concern to make a change in the community. Communication. How are people getting their information? What is the health literacy level of the community? What is the high school graduation rate? What is the primary or predominant language? And how is the media, internet, or television impacting their health behaviors? Are people getting correct information or information that they can understand? What is the average educational level of the community? You can use Google Maps to find the number of schools and after-school programs. The ratio of students to nurses can be found at the Orange County Department of Education website. And much of the data on this slide you can find either at the California Department of Education or the Orange County Department of Education website. Also, the Census Bureau, using the zip code, will give you graduation rates and rates of persons who have a bachelor's degree and higher. You can use Google Maps to find senior programs in the zip code. So look at the slide and look at the requirements for your community assessment. Police and fire. What kind of response does the community receive from police and fire? Do they trust first responders? This is important because many people do not want first responders to show up even when the event is life-threatening. So it'd be good to interview a community member to find out. Are certain behaviors of community members impacting their own health or vice versa? Are first responders' behavior impacting the health of the community? Political structure. Is this community mostly conservative or liberal? Do they pay more taxes, such as city tax, than other cities do? Do they have a board of supervisors or a mayor, or who governs that city? And is it an incorporated city or an unincorporated city? Are they growing? Is there a lot of construction? Is there a lot of influx of people constantly? Or is it stable? So you can probably look at the city website to give a little overview of the political structure. Healthcare. For this slide, you will find a federally qualified health clinic in the community. You will describe who they serve, describe the range of services. Then you will find the number of hospitals, the number of clinics and private clinics. There might be culturally specific clinics, like in Santa Ana, they have clinics that are written in Spanish language. So that would be like a culturally specific clinic. You will find some information about health coverage in that city. Who are the key informants? So remember when I said you were going to have to talk to people? So try to find people who would be in the know about the city, people who live, work, and play, or who hold a good position, a higher position of authority, like police officers, school nurses, somebody who works at the front desk at a school. Let's see, people who work at the Boys and Girls Club. They could be key informants. They could tell you what's going on in the city because they see a lot of people who live in the city, so they know. At senior centers, who runs the senior center, they would know what's going on in the city because they see a lot of seniors. Family Resource Center staff, they would be in the know too because a lot of people go in there for assistance. People who lead food banks are in charge of food banks. So there's quite a few people in the city who you can talk to. Each city has organizations that serve the public. Now it's time to make a community nursing diagnosis, and this is the community nursing diagnosis format. There are 3 components to a nursing diagnosis. The first component is where you state the problem. The second component is the related to. The third component is the as evidenced by. Let's look at the first component, state the problem. What is the problem you identified that your target group has? Is it a problem or are they at risk for the problem? You could state it either way. For example, you could say at risk for injury or increased number of injuries. Then you would say who your target group is. So increased number of injuries for children, or how about teens ages 12 to 17. Then let's go to the next one. Related to, what is our root cause? I'm going to say traffic accidents involving teenagers on electric bikes. And then the next one, as evidenced by teenagers driving too fast on electric bikes, teenagers not understanding the rules of the road or driving on the wrong side, I guess reckless driving, and then maybe the data could possibly state like an increase in teenage injuries, like maybe it could say like the rate is, I don't know, is increasing, I don't know, 40% or something like that. I'm just making this up. And maybe you could, put in like the death rates. Maybe the death rates are, 5% or something like that. So that would be an example of a community nursing diagnosis. And I'm going to post a couple of them so you can see. Here's a nursing diagnosis that I like. Homeless women's self-care deficit due to poor feminine hygiene related to lack of available and safe housing among adult homeless women. As evidenced by, here's your statistic, 74.6% of homeless individuals are unsheltered in OC. Feminine hygiene products are costly and taxed, and lack of private bathing facilities at drop-in and evening shelters. So that's pretty good. Here's another nursing diagnosis. Ineffective health management related to limited physical activity and poor diet among predominantly immigrant Hispanic families in zip code 92832, as evidenced by the lowest fitness gram score in 5th and 9th grades as compared to other zip code areas in Fullerton school districts. And diabetes rate in Fullerton has increased 2% in the last 2 years, so there's the statistics. Despite food pantries and farmers markets, many residents of the zip code area are unaware of these resources and are subject to food insecurity. And the last one they put, articulating fear of being deported if community resources are used. So that's a lot. 3 is probably good. So it's a good nursing diagnosis, and it gives a lot of evidence. And so that's what you want your nursing diagnosis to look like. And you want the diagnosis to be taken from your assessment, your observations, and your interviews and your statistical data. The third step in the nursing process is planning. So you will plan a health lesson, and you will use some SMART goals. The health lesson is your intervention. So this health lesson must be culturally relevant in the language of your target group. It must be age and developmentally appropriate. It must be affordable to your student budget. And it must be accessible by your target population. It must definitely match the nursing diagnosis, okay? Or align with the nursing diagnosis. For clarification, this plan is the written plan using Appendix E, the health lesson template. Okay, finally, making it come together. You will link your assessment and plan with Healthy People 2030. That means, how do these align? You will look at the Healthy People 2030 objectives, and you will align your plan with the Healthy People 2030 objectives, and your plan itself will be in alignment with your assessment findings. So in summary, you will conduct a Winchell survey. You will gather information, indicators, statistics. You will interview. You will observe. You will create a visual representation of the resources. That will be your eco map. You will identify a health policy issue. You will develop the community nursing diagnosis for your specific aggregate or target group. You will plan a health teaching lesson, which will be primary level of prevention that addresses the nursing diagnosis problem. And this will direct your future community interventions. And you will link your assessment findings and health plan with a Healthy People 2030 objective. And that is your community assessment. The community assessment is part 1 of your community intervention. Part 2 is going to include the actual intervention of your health lesson plan and the evaluation of the implementation of your health lesson plan.